And now, what you've all been waiting for, the 25 exceptionals. The awards committee had a great deal of difficulty in narrowing down the selection to 25 individuals. The CNIS wants this designation to be very meaningful. Every one of the 25 contributed in multiple ways to result in substantive improvement of the CNIS programming. They will all receive a second certificate and a digital badge recognizing their status as exceptional. In alphabetical order, Dr. Christine Bloch. She wrote significant portions of the Fundamental Intervention, Referral and Safe Transfer course for midwives. She taught both the SOGC Alarm course, the CNIS Structured Operative Obstetrics course, and the CNIS First courses on numerous times in Tanga, Tanzania. Dr. Respicius Bonifas, an anesthesiologist and injury control epidemiologist. Dr. Bonifas established and directed the Injury Control Center Tanzania, an NGO established with CNIS support. He has been Secretary General of the Injury Prevention Initiative for Africa, another NGO established with CNIS support. And throughout, he has taught trauma team training throughout Tanzania and introduced trauma team training to Rwanda. He has attended the Bethune Round Table on 2 occasions. Mr. Lauren Braun was the program associate for CNIS for more than 10 years. He co-wrote more than $10 million in successful proposals for CNIS and traveled to Ethiopia, Uganda, and Tanzania for the CNIS in support of the African Committee for Essential Surgical Skills. Dr. Sam Bugas, the current chair of the CNIS, took this leadership role after CETA was closed by the Canadian government, when it was not an easy job, and has participated in the successful renewal of CNIS. He has taught ESS in Tanga, Moshi, and Mwanza, traumatic brain injury in Ethiopia, and participated as a content expert in CNIS digital apps. He has also participated in remote teaching of FIRST in Tanga, Tanzania from Vancouver. Dr. Alphonse Chandika, the ESS director in Mwanza, Tanzania for 10 years, where he established a surgical skills lab. And now that he has been transferred to Dodoma, the capital of Tanzania, he is working with the CNIS and Rotary to establish another skills lab. He also has attended and strengthened the Bethune Round Table and been part of the Access Committee in Tanzania. Dr. Jan Chrystela. Dr. Chrystela co-wrote the Structured Operative Obstetrics course, which became one of the flagship courses of CNIS. She has taught that course in Uganda, Ethiopia, and Tanzania. She established the CNIS project in South Sudan and has helped mobilize significant donations for CNIS. Currently, she is the Director of Women's Health, which is a key role in the current era of Canadian feminist development policy. Dr. Robin Fairfield-Smith taught ESS in Moshi, Tanzania, and when CNIS expanded to the Safer Obstetrics in Rural Tanzania project, directed and implemented a significant portion of that project. He's taught clinical officers and assistant medical officers in multiple centers throughout rural Tanzania. He also wrote a laparoscopic section for ESS to help African surgical residents qualify for their CASEXA membership exams. Dr. William Paulette is currently on the executive committee as past chair, and he has served the CNIS as vice chair and chair for more than a decade. He has taught ESS in Tanga and Moshi, trained others to teach ESS in Africa, and on numerous occasions has mobilized funds for CNIS. Dr. Gwen Hollar. Dr. Hollar taught the ES program in Uganda and co-authored the CNIS hernia repair course, which she has also taught throughout Uganda. She has been chairman of the board of the CNIS and has been the lead on the establishment of the Bethune Round Table in Calgary on 2 occasions. Dr. Olive Kobasinji. Dr. Kobasinji co-founded the Injury Control Center Uganda, the Injury Prevention Initiative for Africa, and co-authored the Trauma Team Training course, which has become a flagship for CNIS as well. She has published her work with ICCU as well as gone on to contribute her skills as an injury specialist to the WHO and Makerere University in Kampala, Uganda. Professor Patrick Kayum. Patrick was the ESS director in Mbarara, Uganda, where he established a surgical skills lab with CNIS support. He assisted CNIS expand its ESS program to Rwanda, published his work, supported the African Canadian Committee for ESS, and has been a frequent speaker at the Bethune Round Table. Ms. Lea McCalla. Lea McCalla is a nurse midwife who led the teaching of FIRST for midwives in Tanga for more than 10 years. Close to 1,000 students have completed FIRST at that location. She helped CNIS expand the FIRST course in Dodoma, Tanzania, and has supported the work of the African Canadian Committee for Essential Surgical Skills. Professor Nabath Mambati. Nabath was the ESS patron in Dar es Salaam, where he led the program for a decade. He also supported the teaching of trauma team training in Dar es Salaam. He has published studies demonstrating the value of the ESS program and participated in the Bethune Round Table. Dr. Badriya Mushi is the academic officer at the Assistant Medical Officers College in Tanga, Tanzania. She has supported the teaching of ESS and SOO to assistant medical officers and the teaching of FIRST to clinical officers, both in standard format and remotely via Zoom. She translates for CNIS from English into Swahili as is necessary and has supported research on teaching activities in Tanga, which also has led to several publications. Dr. Susan Oburu, a Ugandan obstetrician, is known as a great teacher and a leader for our structured operative obstetrics program. She inspired the students to learn and the instructors to teach. She always worked very hard and made everything happen when CNIS ran a course. She went above and beyond expectations. The Canadian obstetricians say she was a pleasure to work with. Dr. Tom Okello. Dr. Okello took ESS as a student, and when he was qualified as a surgeon, became the ESS director in Gulu. Every student since Gulu Medical School was established took the ESS course, and this is in large part due to Dr. Okello. In addition to the ESS program, Gulu was a site for the hernia repair course and the traumatic brain and spine injury course. Dr. Okello's experience in ESS was published this year in the East and Central African Journal of Surgery. Dr. William Paulette. Dr. Paulette taught ESS in Tanzania and Ethiopia on numerous occasions. He served on the CNIS Board of Directors and conducted a research project reviewing the impact of 3 CNIS courses over a 7-year period in Tanga, Tanzania. Dr. Tarak Razzig was chairman of the board of CNIS for almost a decade. He taught ESS and trauma team training in Tanzania. He has supported the Injury Control Center Tanzania and collected injury surveillance data throughout Tanzania. He has collaborated with the ICCT in the expansion of trauma team training to Rwanda and to Kenya. Dr. Hassan Shinaza. Dr. Shinaza has been on the board of CNIS and currently serves as the vice chair. He has taught ESS and SOO in numerous locations in Ethiopia and Tanzania. He was instrumental in the development of a partnership with CUSO, which resulted in CNIS establishing ESS and SOO programs in Kigoma, Tanzania. Elizabeth Schaeffer was the CNIS office manager and anchor of CNIS from 2001 to 2014. She worked countless hours connecting all involved with CNIS in Canada and Africa. She called herself Elizabeth of the CNIS, and everyone thought of her as integral to the organization. The success of CNIS is in no small part due to the support and work of Elizabeth. Dr. Mulatt Taye. Dr. Mulatt was the ESS director in Addis Ababa for at least 15 years. He provided leadership in the establishment of ESS outside of Addis in Awassa and Mekelle. In Addis, he helped establish the first CNIS Surgical Skills Lab, which became a template for CNIS skills labs in 4 other locations in Ethiopia and others throughout East Africa. He also contributed to the establishment of the Injury Prevention Initiative for Africa. Dr. Robert Taylor. Bob Taylor was called our man in Malawi, which was true, but in fact he taught CNIS course material on more than 30 occasions in Canada, Tanzania, Haiti, Uganda, and Malawi. He was key in establishing the CNIS throughout Canada as the lead in the surgical public engagement courses. He also edited course manuals and completed a master's degree based on the CNIS Kampala Trauma Score. Dr. Michael Wansberg. Mike helped establish ESS before CNIS was established. He has taught ESS in Canada and did project evaluations in Tanzania. He was on the board of CNIS and has been the CNIS supporter within the context of the Harbinger Foundation. The Harbinger Foundation has donated about $500,000 to the work of CNIS over our 25 years. Dr. Lorraine Wilford. Lori taught SOO in Uganda, and when CNIS expanded to the Safer Obstetrics in Rural Tanzania project, directed and implemented a significant portion of the obstetrical teaching of this project. She edited and updated the entire SOO curriculum. She has been a consistent supporter of the CNIS AGM and has also held fundraisers for the CNIS in Ontario. Dr. Menser Osman Yasin. Dr. Menser was the ESS patron in Gondar, Ethiopia, where the ESS program continues to this day. Thousands of students have benefited from his leadership. Under Dr. Menser, a skills lab was established in Gondar with CNIS support. Dr. Menser was involved in a seminal study of delay in surgical care, which showed that 50% of the delay occurred at the health center. The study was the basis of the first course, another of the CNIS flagship courses. The contribution of the 25 exceptionals was key to CNIS success. CNIS would not have accomplished over the last 25 years what it did without the help of the 25. But the 175 who were nominated also contributed, and the 100 notables were essential. We also want to remember the 7 who have passed on. If you have not had a chance to do so, please check the chat line. There's a link to buy the new red Silver Jubilee t-shirt and another link to renew your membership. Make sure to like and subscribe on YouTube for our continuing content. In summary, due to the help of many, over the 25-year history of CNIS, much has been accomplished. Our gala will continue on Zoom. Thank you.